some perspective on the GOP health care bill from Jan Brewer, of course, the former Republican governor of Arizona. She expanded Medicaid coverage in her state, and now she's urging Congress to save that expansion. She joins us now from Phoenix. Let me ask you, first of all, if this is a piece of legislation you're urging your fellow Republicans in the Senate to support, is this a bill that you can back?
Well, I'm really concerned. We all know that we expanded the Medicaid portion of the Affordable Care Act here in Arizona, and it's been very successful. The problem with the bill, the way that I see it, is the simple fact of the matter is that Medicaid was established, of course, to take care of those in our communities that are the most vulnerable, and with the bill that the way that it's been presented, that's going to cut back. And every state, Nevada, New York, everybody's Medicaid program is different, so it's very difficult. So first and foremost, I think they better slow down and give this some really thoughtful consideration. Maybe even separate the private sector, employer, self-bought insurance from the Medicaid portion of it, because we all know there are no free lunches. Somebody's going to pay for something somewhere along the line. Okay. So if the federal government takes away their federal money to the states, then we have uncompensated care taking place at the hospitals, and then that hidden health care tax that we all have talked about, what it ends up doing is costing us as personal people with our own policies and the employer with their policies to pay for that uncompensated care.
Your state benefited, as we talked about earlier, from enhanced federal support. Mitch McConnell is clearly listening at the moment to those who want some rewrites. Do you think there's any chance of this kind of legislation coming back?
Well, I would assume that Mitch McConnell would not take this to a vote unless he had the numbers, the votes for it. So I think there's going to be some heavy negotiations going on. And it's going to be, as has been said by so many people, we all understand it's very difficult, because every time you shift something, something else shifts. But there are no free lunches. If you're going to provide care for the most vulnerable people in our country, then they have to come up with a solution. And I don't think there's one solution fit all for every state. There's no way that in Arizona they're going to be able to come and expect our legislature and our governor to raise taxes to subsidize what they have been receiving. And of course, we know they're phasing it in, but things change.
Governor Brewer, let me ask you to go back to when you decided to...
$7 billion.
You decided to expand Medicaid. Walk us through what your thinking was then, and I imagine since then you've talked to other Republicans, other governors in other states, other politicians about your decision to do that. What do you tell them about what worked and why that was a decision you did indeed make?
Well, the bottom line in Arizona, the fact is that we're on a capitated service, and we deliver the gold standard as far as Medicaid is concerned. And we had a voter mandate saying that we had to take care of the people up to 100%. So we were way above the 80%. And I looked at it, and we had people out there at one point in time that I had to take off Medicaid that needed treatment, save their lives, people with heart problems and cancer, etc. So I had to give it consideration to expand further and put, we cover 400,000 people, and but it was taxpayer dollars coming from Arizona that was going to the federal government, and I thought, well, I'm just going to bring them back to Arizona. Why should I let them go to California or New York or Nevada? Let's take care of our people. So it was a money issue. But again, there are no free lunches, and no one's going to get care unless somebody along the line is going to pay for it.
And this is
clearly... our emergency rooms now are...
Yeah, so the emergency rooms, your view is they will end up paying the bill, I suppose. We had the CEO of Johnson & Johnson on programming earlier on today, and he was saying that, OK, this is a short-term focus, of course, around this legislation, but this is a 10 to 20-year project, he said, to get healthcare right in the United States. What would your assessment be?
Well, I agree. It's very difficult. It's going to take time, and everything you do and everything that you adjust is going to have hiccups in it. It's going to create problems. And, of course, there's always winners and losers in anything that the federal government or any government does, It's not an easy job. But they've got to be cognizant of what they're embarking upon, and every state is different. So this one bit of trying to fix it so quickly without us knowing exactly what the real costs are until, we hear from CBO, and the length of time, and then postponing it, get it done so everybody can go back out and get reelected, et cetera, and then get the hit, really concerns me. really concerns me.
Thank you very much. Former Arizona Governor Jan Brewer joining us on the Healthcare Story.